Well, if you were surfing the internet of healthcare, you may have come across a scandal yesterday. It is the April 7th episode of Health Tech Deals. So, how'd you like that internet of healthcare reference about the olive story? That involves internet of healthcare.
So good. Okay, well, we do have to joke about the internet of healthcare, and then the other one is at the both ends of the fax machine, and there's all that stuff going on.
I can't believe you didn't get that. So yeah, that olive scandal story coming out of Axios. What do you think?
Yeah, Erin Brodwin had a real go at him. There were some things that could potentially be difficult, right? So there was issues about, were they mishandling PHI? A lot of companies have had trouble with that, not always, including big healthcare companies. What happened with the Epic thing? Epic is super important. If Epic says don't use these guys, it's, or anybody else, it's a big knock anyway, because everyone goes to Epic in the big systems. But basically it was saying their salespeople, promise the moon and they get delivered a small mountain outside Kentucky or something, rather than, the access to the, the ladder to the moon, and they don't deliver on all the stuff they're claiming. And if they're in trouble for that, I mean, which health tech company?
Right. Which tech company? I mean, any startup.
Exactly. I mean, now but the question, we don't know the answer, right? The answer is they have 80 clients, 200 clients. People talk, I don't know, we had that Well Health interview you did yesterday about how many clients do they have, where we said we have X hundred hospitals, but how many systems are there? How do you count a client? None of this stuff matters until you get when they're going public document, the S1 or whatever they're going to do, and it actually tells you what the actual revenue is, what the revenue per customer is, and whether they're losing customers or gaining customers. And if Axios knows more about it, they should have told us, but they didn't. So you're just like, it's sort of floating out there in space. I suspect that, like any company, they've probably grown incredibly fast. I mean, we know they've grown incredibly fast in terms of headcount, and that stuff has probably got missed, and they'll have to do a bit of cleaning up. But they have, everyone's agreed they have 80 hospital system customers, which is a lot, right? There are only about 300 hospital systems in the country. So I suspect they're doing okay. Who knows? They have a bunch of competitors who will come after them, right? Akasa and the Notable and a bunch of other people. So, it's not going to be easy, but we shall see.
We shall see.
Interesting though, but you don't often have somebody go at a private company that hard unless they think there's actually a really big.
Yeah, that was really.
And she didn't come up with like the real smoking gun. So we'll see.
Yeah.
I don't think she'll be running on the olive bus anytime soon. No. All right. Right. So. Do we have a few more deals today?
No human baseball hat for her.
No tracksuit for her, yes.
Let's do these deals, my friend. We've got a bunch of them. All right. IntelyCare gets 115 million, brings their total up to 170, valuation at 1.1 billion. This is another one of those nurse staffing companies.
This is unbelievable, right? We now have them, Connect, RN, Trusted Health, ShivMed, Nomad, CareRev, Incredible Health, at least all of whom have got somewhere between $50 and $200 million in funding to them. Clearly, nursing staffing is a massive, massive problem. All the nurses in America were getting old anyway. They all retired due to COVID. It's a horrible, horrible job. Every hospital is screaming about this at the moment. And, I don't know how but these guys, yes, they're putting together a platform to hire nurses easily and blah, 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 and probably eventually taking away from those local staffing agencies. But it doesn't solve the basic problem is we ain't got enough nurses.
Right.
So, right. I mean, I'm sure they'll do well, but they won't all survive.
Okay. Avi Med, German telehealth company, they get 50 million euros.
Yeah, this is weird. So, I mean, I don't know. There's that big group, Swedish telemedicine company, a bunch of other Dr. Lee and other telemedicine plays. And these guys are kind of doing primary care, integrated testing, hybrid primary care, and they're integrated testing and stuff. I'm surprised there's room for another one.
All right, Eleos Health, they get 20 million, brings their total to 26. This is patient comms and administrative stuff, right?
Well, this is, as far as I can tell, to help traditional behavioral health providers, clinicians, compete with the Lyras and the Gingers by putting all the kind of patient-facing stuff. And they've also got a kind of ambient dictation note-taking thing to improve the follow-through of notes. That's a very tricky thing to do. But they've got F Prime in this who know what they're doing. So hopefully it's a good deal.
All right, Evernow, they get 28 million. There's a bunch of celebs in this one. This is a telehealth menopause company.
Yeah, Gwyneth Paltrow, Drew Barrymore, Cameron Diaz, A bunch of others are in this one, but also NEA, and it's a big play. 28 billion for menopause is big, right? Gene's got 5, that UK one, Vera Health got 14, but that's a big play here. I wonder.
All right, what about Vivosense? They get 25 million. I'm not sure what this one does. I could not follow it.
So I think, oh, we're right on the button. Hopefully I'll get this right. So I think what's going on here is this is an attempt to put kind of like, Evidation has the platform where you are doing sort of live clinical trials using people's phones or whatever. They're trying to do this with sensors, a little bit like Bioformus, which is trying to put sensors out to do a combination of sort of patient-focused tracking of what they call subtle shifts in human physiology through customized body-worn monitoring, which sounds like I'm going to put a bunch of sensors on you, and if you have Alzheimer's or whatever, maybe do something a bit differently. There is a bunch of people trying to sort of figure out what seniors are doing in the home. Some of it's either for care delivery or med alerts, or it's for clinical trials, and they're going down the clinical trial route. 25 million from a bunch of people I've never heard of. Debio Farm and the Perceptive I can't even pronounce this. The Perceptive Extonergy Venture Fund.
I'm sorry, can you try that second one again?
Extonergy, the PXV Fund. I don't know. Who knows? I just wanted to put this one in so I could try and pronounce Exontogy. No, can't do it. XONTOGENY.
Still looking for a subtitle sponsor over here at Health Tech Deals.
I spelled it out.
I think we may have found them. I'm reaching out to that fund. I'm going to be like, listen, I'm going to need you to sponsor subtitles, and here's why. Watch this footage of this man trying to say the name of your fund. And that's just your fund.
Well, that is the hardest one to say.
Hundreds of videos. I mean, literally thousands of hours of footage.
All right, enough torturing me. Get us out of here.
Okay, if you want to torture him yourself, go over there on Twitter and follow him at BoltyBoy. Send him some DMs. He loves that. Tweet at him. I'm over at Jess DeMassa, and to never miss an episode of Health Tech Deals, sign up for our email newsletter over there at thehealthcareblog.com, and you will get the best content of the blog, including these episodes and all the blog posts and my interviews, delivered directly into your inbox every week or whenever we feel like sending it out.